Hi, my name is Dr. Nick Cambouris here at the Chiropractic Spine Center. I'm the senior clinician, and this is Miss Taylor Danner. And Taylor has been dying to ask me some questions. So I'd like to give the floor to her, and I want you to go ahead and ask away.
Okay, so I've had a lot of people come up to me and ask me a bunch of questions about headaches. Is it true that chiropractic can cure headaches?
That's a great question. Well, there's a lot of reasons of why a person can get a headache, literally thousands of different reasons of why someone can experience a headache. So some of those reasons chiropractic cannot help with, but most it can. Most headaches are caused from a musculoskeletal condition or stress in the muscles or in the joints, especially of the neck and the back of the head. And those kinds of conditions chiropractic can help with. If you have a hormonal deficiency or perhaps you just aren't getting enough nutrition, things like that, chiropractic adjustments cannot really affect well. However, changing your nutritional plan can. Other times when there are hormonal changes that could be genetically linked, a good time to see a neurologist can help you by providing you with medication to alter those hormones in your body. So dependent upon what the condition is, depicts whether chiropractic care is appropriate, which is really the reason why it's important to see a chiropractor for that evaluation to determine whether or not it's something that they can help with.
Okay.
Does that help answer the
Yes,
question?
it does. How does chiropractic treat headaches?
So chiropractic care is all about helping to provide more nourishment and a healthy range of motion to a joint. More nourishment means increased nerve flow or a relief in nerve flow and increased blood flow. Blood flow is going to bring nourishment and nutrients to the joint. That's what's going to keep the joint healthy. It's going to help keep it lubricated. And chiropractic care helps to do that for the joint. It reduces something called a subluxation, which is basically a misalignment of a joint, which could be caused from a numerous amount of stressors, the number one being gravity. Gravity puts stress on our joints. Any weak spots will allow the joints to shift out of position, and that's what chiropractors find and help to position back in place through the use of chiropractic care and exercise.
Oh, wow. Okay. One last question. What's better for the cure of headaches, seeing a neurologist or a chiropractor?
That's also a good question. Neurologist and a chiropractor are both qualified to deal with headaches. And quite frankly, it makes no difference in the initial evaluation because the evaluation is an exam to find out what's wrong. So whether it's a neurologist or a chiropractor, we're going to find out what's wrong. The question is how do you treat it? So for example, if a patient came to me and through the evaluation it was determined that an MRI was a good idea, we get a brain MRI and the MRI shows that there's a tumor, that's not something I can adjust away. That's something to go see a neurosurgeon for. So we're going to refer him to that neurologist. Same thing if a neurologist does an exam on a patient and determines that the reason they're getting headaches or migraines is because they have a lot of tension in their neck and that patient is experiencing cervicogenic type headaches, then it would be a good idea to send them to the chiropractor because the chiropractor can help that condition. Does that make sense?
That makes a lot of sense. Thank you.
Absolutely. If you have more questions about your headaches or migraines, please feel free to visit us here at the Chiropractic Spine Center or your local chiropractor. I know we can help.